Hi everybody, this is Dr. Vishnu from the American Acupuncture Academy here in Mount Dora, Florida. Wanted to talk a little bit about the pulses and why when you go to an initial visit with an acupuncturist or in any follow-up visit, you will find out that before the acupuncture takes place, they will look at the tongue, which we've spoken about in a previous post, and they will also feel your pulses. And why is that important? Well, in Chinese medicine, there are 24 different kinds of pulses, and there are 3 positions on each wrist. If you look here, the 3 positions here on the radial side of there we go, on the radial side of the wrist, just above the wrist crease, and the same thing here, you'll find 3 positions here on the left side. So each position relates to an organ. And there is a superficial and a deep pulse. And the quality of those pulses and how they feel has everything to do with a reflection of what's going on with the organs. Is it thready? Is it wiry? Is it deep? Is it soggy? And are the pulses, can you feel them all? Sometimes you can only feel certain pulses, other pulses don't show up. So these pulses and their locations and the indications when someone sits, when a practitioner sits and feels your pulse, is indicative of what's going on with the organs in the body in relationship to what you tell your acupuncturist, what's going on with your symptoms, whether they be acute or chronic. This will give him a really clear indication of what organs are involved by the nature of the pulse. And of course, then what points you can use to help correct the issues, to create balance. And so this is all about balance. So that's why when you go to an acupuncturist, the first thing they'll do is they'll look at your tongue, they'll feel your pulse, they'll ask some questions, they may palpate another area. We'll talk about in the next video, abdominal palpation and why that's important. And so we're garnering information from the asking questions, from smelling. It's important when you go to not wear perfume, because your scent reveals what's going on inside of you. And we can talk about that in another post. We'll talk about scents or your smell, and how that smell and the differences of your smell are also key indicators of what's going on with the organs and where there might be some level of imbalance, something too weak, something too strong, something out of balance, which again causes some either acute or chronic issues. So stay tuned for our next post on the smells, and if you have questions, please feel free to contact us through our website, a3acupuncture.com, or you can email me directly at 1 acudoc@gmail, or call us at the office 352-729-4361. Thanks for listening. Have a great day.